Let's get some reaction to that breaking news on your screen. South Africa has suspended the rollout of the Johnson & Johnson vaccine, and this is around concerns about blood clots that are being investigated globally now. Dennis Blum from COPE joining us. Your response, Mr. Blum.
Good evening, Francis. No, we as the Congress of the People want to welcome this suspension that the minister have announced. For one reason, it will be in the best interest of the people of the country. You can never be reckless that when other countries are facing a problem in using the Johnson & Johnson, then you are stubborn and using it and putting the lives of people in danger. But we must say that we see big problems. It was first AstraZeneca and now it's Johnson & Johnson. This call now is getting now louder that we must start manufacturing our own vaccine. That will be the solution. Then we will be sure that our product is safe, our product is ready for our people.
Do we really have time to do that, Mr. Blum, when there are already several vaccines on the market that have been developed over time and there's a potential third wave? People are going to get sick while we're trying to develop our own vaccine.
No, I agree with you. I am saying that we were fast asleep. When other people were busy with manufacturing their own vaccine, we were depending on other countries. That's why I'm saying this is a call for us to wake up and not depend on other countries. But we really welcome this because lives of people are more important than putting the lives of people in danger.
Much. Dennis Blum from COPE reacting to government announcing tonight, the health minister, that South Africa will suspend the rollout of the Johnson & Johnson vaccines. But it sounds like the Johnson & Johnson vaccines that we have procured will still arrive in the country from next week. Remember, large shipments are expected and we're waiting for those because the vaccination drive, the first phase, has stalled while we wait for more deliveries of more vaccines. So these vaccines will come into the country, hopefully. The matter is clarified by then. He says he hopes it could just be a few days, not too long, until we know if there really is a link between these blood clotting events that have been recorded in the US and in Europe and the vaccine itself. All right, Bantu Holomisa with us. Mr. Holomisa, your response to what was said tonight.
Well, I think the minister had to take a safety route, and we cannot query him for that. However, it says a lot about our agencies here who had given a go-ahead on these vaccines. And this thing of being copycats is going to delay the whole setup. But there's nothing we can do. They are taking a safety route.
Is it not the right route? You're saying that South Africa maybe should have picked this up, but I mean, millions of vaccines have been given in the United States, for example, before they even started realizing there's a potential link, not even a proven link. Well,
I think let's accept the word from the scientists and the doctors. I cannot try and oppose this one because there are a lot of questions which still need to be attended to and answered, especially by the agent, as government agent, which had approved this drug.
All right, thank you very much. The UDM's Bantu Holomisa reacting there. And let's just recap. South Africa announcing that it will temporarily halt the rollout of the Johnson & Johnson vaccine. The Minister of Health said there has been discussions, especially in light of the decision of the FDA, the Food and Drug Administration in the US, to recommend that it be suspended there. And of course, this comes after millions of people have received the Johnson & Johnson vaccine in America. There have been 6 blood clotting events, so these are rare, and scientists aren't even sure if they would have happened anyway, or if this is linked to the vaccines. But there have been these concerns in relation to AstraZeneca and also Moderna. That was confirmed by Professor Gray tonight, as well as Johnson & Johnson. She said they are looking to see if these are different blood clotting issues based on different vaccines, but that link really not proven yet. And for a while there have been concerns. Of course, the EFF before this had called for the immediate halt of the Johnson & Johnson rollout.